A week ago, freshman Democratic senators came to this floor to discuss, as a group, how our current healthcare system is broken and unsustainable. Today, we return to address the challenge of runaway costs.
In 2000, family insurance purchased through an employer was approximately $6,700. In 2008, it has nearly doubled to $12,600. And if we don't act now, by 2016, family health insurance is expected to double again to nearly $24,300.
We are consuming almost 20% of our gross domestic product on health care, devoting almost a fifth of our economy to health care, when all our competitors across the globe are devoting less than half that to health care.
Some may say that the simple reason of these increasing health care costs are because we have an aging population. Well, we do have an aging population. But an aging population is not the effect of the rising health care costs. Our rising health care costs are increasingly driven by an inefficient delivery system.
This is a fundamental problem with our health care system and something we've got to work on. Things don't have to be this way. We can find savings in our system and still provide high-quality care.
If you want to do something about runaway health care costs, the way to control runaway health care costs is to institute prevention and make prevention a major part of this bill.
Each year in this country, we spend $2.2 trillion on health care, and 75% of all health care costs go to treat chronic diseases, many of which could have been prevented.
Let me give you an example. Today, Medicare actually pays doctors and hospitals more to amputate a leg than it does to treat early diabetes and actually prevent that amputation. Our government should be paying for quality outcomes, not writing checks that encourage expensive care that could have been prevented in the first place.
This is not just a moral imperative on its own right, but it will help us achieve the cost savings that our health system so desperately needs.
We know that the nation's health care costs are steadily bankrupting our government and our citizens, and we owe it to every generation that comes after for us to act now.